listening to all the presentations, one thing that struck me is really the quality and the depth of excellence we have in our educational programs here at the Medical Center. But one thing that also strikes me is that I didn't know half of what I heard. I mean, it's really, I think, numbing to think that there's so much innovation going on, and most of us are hearing about it for the first time. I think that really highlights the challenge that we face if we truly want to become the very best that we can be in education. We really have to think about how we work together and maybe make these efforts known more. And that's why I really commend Howard and the faculty development group for arranging a day like today. But I think that really brings us into the idea that we're going to be presenting to you today. There's a tremendous change going on in the world of education. There's tremendous change in technology. We heard Kelly Kawasaki talk about the changes that are going on in how we view education in terms of moving from assessment based on what people should have known based on the content to what we expect them to know based on where they're supposed to be going. And really the question for us is, how are we going to handle this change? And are we going to be followers or are we going to be leaders? And are we going to have an opportunity here to add content that will make us of value as we move forward? So let me just frame that very carefully. In about 5 years, some people will say maybe 2 years, everything we teach right now, somebody is going to have it for free online, guaranteed. Either for free or they're going to have it in a way that they are the ones who have the content, and we're going to have to either buy it or we're going to have our own content that we actually also use to trade. So this is going to be the currency by which we talk to one another. The generation that we're teaching right now, they know how to get information. They're not interested in us giving information. What they want to know is how could they use that information in a meaningful way. So basically, what we're thinking about here is how we can harness this into something we're calling IXL. And basically, we want to be leaders in transforming health education. You already have shown, based on the presentations today and what I know about what a lot of you are doing, that you are leaders. And I will tell you that a lot of these ideas spurred by a visit that we took to Toledo, where Chancellor Gold has formed this Center for Creative Education, where experiential learning, where a bunch of us went, and we went to basically look at what he had developed there. And we didn't really want to necessarily recreate what he had there, but we were thinking, what could we do here at UNMC that would allow us to address these challenges that I just talked about? And these are the people who went. I'm not going to spend too much time on that because I really want to get on. I know everybody needs to leave by 2. But one thing that struck me was that there was a lot of, they had a beautiful building. By the way, this is like I believe it's a 40,000 square foot building. It was a beautiful building, lots of technology. But I will tell you that we have almost all the technology they have there. That's really not what excited me. What I think really intrigued those of us who went was the integration. And what the integration allowed them to be able to do that we're currently not able to do. But we're on the verge, based on what we already have and based on how we're interacting with one another. We are on the verge of being able to do what they're doing. And in fact, the people there, based on what they know about us, because actually one of their leaders came here and saw what we had, thought that we're actually way further ahead than where they were when they started. And so here's really some reflections about how we're different, and I could tell you what we observed, but it'll come out in my comments as we move on. But creative and experiential learning is going to be the norm for education of health professionals in the future. So it's not going to be about sitting in lectures. It's going to be about simulations and interactive learning and online, and then the classroom is going to be more for interactive learning, not for that kind of. And then we talked about competency-based. At the medical center, we have superb. All kinds of tools, and we have all kinds of enduring curricular changes that are going on. The challenge is that they're siloed. And these silos limit the opportunities to innovate and maximize educational research and healthcare opportunities. And this impacts us locally, across Nebraska and globally. One thing they've been able to do in Toledo, by being the first entrant in this area. So what do they have? They have a lot of the same things. We have simulation. They have virtual reality caves where they can do immersive 3D things. So you can actually do everything from research, where you can take a cell, blow it up, and literally walk on the cell and look at the surface of that cell and think about how another molecule may fit in if you're a pharmacologist. Or you can actually have virtual reality where you can take a heart and walk through the heart and see what the valves look like right there and actually interact with it directly. But more importantly, what they've been able to do is by working, getting all the different professions to work together, they've been able to create very interesting curricula that there's a big vacuum right now in this area. And so they're creating the content for this right now as we move forward. And they've also been able to attract a lot of attention from the military, from industry, and it's allowing them to have partners that's actually changing the way that we one may think about education. So we have a unique opportunity to be pioneers in integrated use of technology tools for creative and adaptive experiential learning. So here's a vision. This is not my vision. This is a vision that's jointly formed by many people. Certainly all those people were involved in the trip, but it's gone now through the Education Council retreat. And this is really the vision. That we are the global leader. UNMC is the global leader, game changer, in integrated, interprofessional, and interdisciplinary creative and adaptive experiential learning for the health sciences and beyond. Now, it's a very bold vision, and we recognize that. But the reality is that if we truly want to have an impact in this area, we have to either decide we're going to be bold and be one of the leaders, or we're going to have to just wait till somebody does it and then just buy the products and just say we're going to just be part of the whole crowd. So here's the premise. Transformation of the educational experience and health outcomes occur when creative and experiential interprofessional health science learning is delivered contiguously and integrated over a lifetime. What do we mean by that? So here's we have a lot of pipeline programs that we have a lot of students that we're teaching before they ever show up to the medical center. We have programs that we're dealing with pre-K, K to 12, all the way down to graduate, postgraduate, continuing education we just heard about. Patients, ancillary groups that we interact with and we teach them. The question is, how do we integrate this in a seamless fashion so that when we're moving from one level to the next, it's pretty clear what the connection is. And that connection is fairly well defined, and we can actually make sure that it makes sense. And of course, I talked about the opportunities for basic science here. So this is the curricular part, is where we can get our curricular committees together and think about how we can actually truly integrate as much as we can, not only across disciplines, but horizontally from K to 12, or vertically, whatever you want to call it, from K to 12 all the way up, and see how that all flows. So if I have a module that I can use that module not only for nursing and for medicine, but I can actually decide, okay, if I have 6 of these modules, maybe the first one can actually be good enough for high school kids that are being taught through our High School Alliance and so forth. But above and beyond that, we also have all these tools. Actually, we have all these tools that we've been talking about: interactive learning, the wall for 3D. We have simulation, a whole bunch of things that if we could actually harness them in a way that they're actually together. So you can have a child come in, or a student from any profession come in, have an interactive online learning class, come into class, have a flipped classroom, go from there to a simulation exercise, go from that simulation exercise to a virtual reality exercise, and move from there to a virtual hospital before they ever step in the hospital to see a real patient. So that patient will never have to worry about July and change of rotation, because that student will actually have done a lot. So it creates opportunities for advanced interprofessional and interdisciplinary education. It leverages the interactive educational activities across the educational continuum. And actually, here's the key: human performance. We're going to be assessed, we're going to be paid based on quality and based on outcomes. We just heard that. And this is all about human performance. We need to have a way where we can actually make sure that we're evaluating, we're training our students and our faculty in a way where they can maximize quality and outcomes of care. And then research and best practices. We can cut down infection control rates in the hospital to 0% by simulating it in the virtual hospital before we actually show up. Dissemination of practices. If we enhance and integrate better how we're not only located, but how we communicate with one another, then we can actually adopt best practices very quickly. So rather than waiting to come to an excellent conference like this, there'll be opportunities to actually have other people adopt good ideas. So it gives us opportunities to partner with the military, other universities, industry, intellectual commercialization. And, allied health, for example, Karl Mayer pointed out that they're having more and more pressure on clinical sites, and we all are, I think, the same thing for medicine. But, it's going to get so good and so real that we can actually use, not for all experiences, we should be able to use simulation and virtual reality for a lot of them as we move forward. Improving health outcomes, and also allowing us to coordinate in a way where we can reach all of rural Nebraska and actually around the globe through all these things. So what do we need to be able to make sure that all these things happen? We need to be able to think about how we can co-locate all our tools, and I'm going to talk about that. We have to make sure that it's accessible to all our learners from our medical students, nursing students, pharmacy students, all the way to our alumni. It's got to be sustainable, because we all understand that educational things are not easily funded, so we've got to make sure we get the money for it. It's got to be coordinated. Outcomes are going to be key. If we can't show that we're having any better outcomes than with the current traditional way of doing things, it would have been a waste. We've got to make sure we implement it, and it's got some challenges in there. So can you imagine having all these things? These are sort of the tools that we've talked about today. Many of them we've talked about today. But rather than having them siloed, or at least having a sense of how each one is functioning. This is not saying everything has to be under one roof, but we have a sense of how they're, coordination of how they're working together. So we have the interactive e-learning laboratory, flipped classrooms, the caves, advanced simulation, surgical skills center, virtual hospital, telemedicine network, standardized, certified testing center, faculty advanced teaching academy, cost center for blended learning, all of these integrated in the fashion where we know what's going on in all of these areas, and we can actually program them in such a way that each one of them is taking advantage and they're actually making sense, so that what's happening in simulation is not happening independently of what's happening with virtual reality or with interactive learning. Doesn't mean that one is going to stop the other one from doing it, but we're all aware of what's going on, and it allows us to create curriculum and actually to make sure that we're taking advantage of the innovation that's been made in one area, enhances our ability to actually make things happen in another way. So this idea of co-location will also serve as a hub for reaching, for example, if you're College of Nursing with all your different SIM sites, you can actually use that to coordinate all those SIM sites. So it will enable us to actually be able to provide better competency-based care. So accessibility, I'm going to skip through these very quickly because I know that we're running out of time, but basically we want to limit barrier to usage, make sure that it's readily available to the clinical enterprise, the community, and low barrier by all other groups. And we want this to be truly a global destination for innovation. In order for this to be sustained, we know that we're going to need a lot of philanthropic support. We're going to have to partner with the industry, and be a luminary site for some major partners. Intellectual commercialization, partnering with the military. We happen to have a strong military presence around Omaha, and they're very interested in human performance, and that's where we can work with them. And we can learn from them, they can learn from us. And coordination, so the key thing here is that, the building is irrelevant. It's not the key. The most important part is the coordination, the programming, how we think about this. And this is going to take a lot of effort, and we all have to sort of decide that this is where we want to go, because this is going to take an incredible amount of effort from everybody, and allow the curriculum committees to think about this. We're going to have the hub and make sure that it's interdisciplinary. We have all the right players that we need. And we're going to have to keep on top of what's going on nationally to make sure that we're there. Again, it's got to be something that we show that it's working. We've got to make sure that we're looking at outcomes. We're looking at all the different potential opportunities to present our findings nationally and internationally. We have to have dashboards for the technology and other innovation. And we've got to have partnership and other types of collaborative dashboards. And most importantly, if it's not physically sustainable, it will, no matter how good it is, going to just end up fading away. So the issue here that we talked about at the retreat was the fact that we need to really move quickly if we want to be a pioneer. We're currently well positioned, but if we want to be truly a leader, we can't be one of the last entrants or one of the middle entrants. We have to be one of the early entrants in order to catch the whole opportunity for the advantage that we would have. We have local philanthropists that are very interested in this, and again, they're not going to wait for us forever to come up with the ideas. And then we have industry and military partners who are also very interested in this area. So we do know that we have some challenges, and that's really, making sure that we all work together. I think this can be overcome. I know that because I'm on the Education Council. We work together all the time, but these are some potential challenges. Make sure that we engage the clinical enterprise, and it's not a UNMC issue alone, it's for both sides. And make sure that the curriculum committees on all the colleges are working together. And we have to have an organizational culture that supports this vision of the future. So here are what we're calling our next steps. We're in the process of putting together a guiding coalition. We're going to be seeking internal and external constituents. Virtually everybody in this room will be touched for your input at some point. We have to get campus support for informational communication, and get the philanthropic support for it, and secure structured organizational approach. I'm going fast, but we had this retreat, and virtually everybody was strongly supportive of that. We had 35 members participate in that, and this was one of the things that came out of that, was that we should move ahead with this. And so I ran through that very quickly because I'm trying to make sure I'm not the one. Actually, I think I'm right at 2 o'clock. I was given 15 minutes. I think I just made it.